Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today is another day for an interesting topic: diabetes and the rate of bacterial infection. In short, diabetes and bacterial infection rates. This effort of mine is to allow us to think a little that those days there were not much noise about diabetes, but these days, probably because of the junk food and so many obesity that we have left, right, and centers, that could we now be ascribing the cause of diabetes to more of the microbiome, that is the microbiota, what is contained in our gut, the bacterial residence there. There are so many findings that would interest us all as we journey in this discussion, this exposition that I am trying to scientifically present to you. Bacterial infection is a serious problem, and bacteria thrive like every living thing where it has things that will nurture its growth. But when the population of those resident bacteria, that is those ones that are very protective, have been overtaken by the ones that are injurious to our body, to our health, then we don't know what that disturbance of the ecosystems will surely cause. But the effort I am making today is to see what we can derive from this, from studies, from past researchers, that they have discovered so many things, and I shall pinpoint it by trying to relate diabetes to bacterial rate of infection, diabetes to other things that we have already known. So let us hook on and listen as we try to first of all look at definitions. According to World Health Organization, diabetes is a chronic disease characterized by elevated level of blood glucose or blood sugar, whichever name you want to call it, which leads over time to serious damage to heart, blood vessels, eyes, kidney, and nerves. In fact, could damage any organs of the body. Just name it, so long as the bacteria can grow and spread there, it will start establishing serious damages. Diabetes is on the rise worldwide, with a global prevalence in adults in 2019 being 9.3% of the world population. In total numbers, this reflects a population of 463 million people with diabetes worldwide in 2019, with a projection of an increase to 700 million adults by 2045. A further 1.1 million children and adolescents under the age of 20 live with type 1 diabetes. When we talk of type 1 diabetes, we are talking of those that are not insulin dependent. That is, you don't have to inject them with insulin. And that's International Diabetes Federation opinion. The association between diabetes and bacterial infection is well recognized, and the work of Pega A.Y. et al. Shows all these complications. Talking about complications, you can see these open wounds. It is caused by the bacteria really cultivating itself in that area, producing enzymes that are digesting the skin as well as the cutaneous and subcutaneous layers of the human body. So it keeps penetrating, and before you know it, it turns to the gangrene. There are categories of stages that when you look at these stages of damages, you come to a stage where you can even give up that this person is treatable. It's just because bacteria is allowed to grow. Now let's look at this feet or foot of somebody. You can see that the stage 0 is when there is no damage at all. But Stage 1, you can see that red patch. It is showing sign of bacterial growth. Stage 2, it has caused ulcer. Stage 3, ulcer widen. 4, ulcer. Then the gangrene is there. By the time you get to stage 5, you can see the gangrenous growth. Now let us go into researches. What are the research findings? Researches more or less try to really prove or disprove, or more or less in a simpler word, say what we consider as a fact is truth. And if it is truth, then we can use it to predict future problems or future dispositions. So let us watch the bacterial researches that I shall expose. Research findings. 1. When you have diabetes, you are especially prone to foot infection, yeast infection, urinary tract infection, and surgical site infection. That is very common, especially the foot infection. 2. Diabetic neuropathy, nerve damage, is a very common problem too, where you are not feeling any sensation in your finger, your feet. This lack of sensation sometimes means foot injuries go unnoticed, untreated. Injuries can lead to infection, and infection will now really cause the serious complication that may warrant cutting off the foot. 3. According to WHO, free sugar are the essential dietary factors in the development of dental caries. Dental caries develops when bacteria in the mouth metabolize sugar to produce acid that demineralizes the hard tissue of the teeth, enamel, and dentin. And that is very instructive, because the plaque produced is where these bacteria will multiply, heat up, and then enter into the bloodstream, affect the heart, the pericarditis, it causes pericarditis and all the other heart problems. 5. There is a bidirectional relationship between diabetes and bacterial infection. This is a kind of situation of which comes first. Is it the egg or the hen? While diabetes increases the susceptibility to bacterial infections and its complications, chronic infections such as peritonitis is associated with increased pro-inflammatory cytokines, which can exacerbate insulin resistance and worsen glycemic control. That is a fact that I try to emphasize in this study. That is, you can control diabetes by using the glycemic control, so that you do not become insulin resistant at the end, or move from that situation of being non-insulin dependent to now insulin dependent. There is a recent growing evidence too that abnormalities in the microbiota, which I said earlier, composition, can have a major role in the development of diabetes. This was by Pascal and his co-workers. Now moving on, let's look at the epidemiology of pathogens, where we really want to talk about patients who are having diabetes and those who do not have diabetes, comparing those who have bacterial meningitis. That is the risk ratio analysis here. You have a 95% confidence interval in diabetes compared to patients without diabetic of caused by strep pneumo and Listeria monocytogenes. That was a study by Van and his co-workers. Malignant otitis externa problem, infection too, you can see, caused by Pseudomonas aeruginosa, was also found to have a 95% confidence interval. The same thing with peritonitis. In diabetes compared to patients without diabetes, you find an increase in the numbers of people who have this peritonitis, having staph species, strep species, bacillus species, E. coli. A work done by Van T.T. and his co-workers and the other. Then the commonest is episematous cholecystitis, that is of the gallbladder, which research is that the diabetes mellitus and rate of infection. This is the real reason for this study. Poor glycemic control increases the risk of infection in diabetes. That tells us that when you are having no control as regards your level of glucose, the rate of infection increases. A recent study examined the association between glycemic control in 85,312 patients with diabetes mellitus aged 40 to 89 years and the incidence of infection. Infection rate rose steadily with HB hemoglobin A1C, which was particularly evident among those with hemoglobin A1C greater than 11%. This checks the average hemoglobin level within 2 to 3 months, and normally you should have between 5.7 or lower when you really control your sugar. Now to laboratory diagnosis, my area of specialization. You're not talking of glycemic control, the test you could do, I told you earlier, HbA1c, fasting blood sugar, and postprandial blood sugar estimate, and we could also do microscopic culture and sensitivity of any area of bacterial infection. Just collect the samples and it is done and treated to know the specific organisms and the sensitivity, the antibiotic to. By way of conclusion, we have seen that diabetes could be as a result of genetic problem, that is inborn error of metabolism that the person has imbibed from the parents, or it could be as a result of one just developing it. And if that should be the case, we have also seen from the researches that if your diabetes glucose level is controlled, the non-insulin dependent diabetes, which we call type 2 diabetes, will not go on to the level 1, the type 1 diabetes, which is more or less insulin dependent, except you are able to inject insulin. And I'm sure there are greater things that are now done to help in that direction, where you may not be injecting so much, but I don't know how successful that has been. But to not go to the extent of having to inject yourself every day, more or less, because the cells of the body needs energy, and they get this energy from carbohydrates, from glucose. And if they are not broken down to give the ATPs that the body needs to do all the respiration and all the energy requiring activities, the cells of the body will gradually die. So to not get to that war situation, it is very necessary for diabetic patients to control their glucose level. And so it is advisable for you to visit the lab once in a while, even if you have a glucometer, because the glucometer, you can never be 100% sure when it malfunctions. But when you are able to control it with, recheck whatever you have gotten with laboratory investigations that confirms, yes, that this is your true blood level of your sugar, good. And that means we continue to live a better life. If you like what you are seeing and you like my production, press the like button, subscribe. That's all that will encourage more production. Thank you.